Introducing Calibra Ceram Adhesive Resin Cement, ideal for glass ceramic restorations such as zirconia-reinforced lithium silicate and lithium disilicate, especially in clinical situations where strength and aesthetics are required. Plus, its 10-second tack cure window and 45-second gel phase offers fast and easy cleanup. Let's review it in use during a single-unit crown procedure. Matching the right cement to the chosen restoration substrate is key to clinical success. The clinical diagnosis is recurrent decay on an endodontically treated tooth, which requires extensive caries removal followed by a full coverage crown. Because of the aesthetic location, a high-strength glass ceramic material is selected. Calibra Ceram Cement's high strength, aesthetics, and easy cleanup make it the ideal cement for this procedure. When the patient returns to receive their final crown, remove the provisional and clean the tooth surface of any residual cement. Try in the crown and make any adjustments needed. To prepare a glass ceramic crown, etch the intaglio surface with 5% hydrofluoric acid etching gel for 30 seconds. Rinse thoroughly with an air water spray, then thoroughly dry the restoration. Apply silane to the etched surface and allow it to sit for a minimum of 60 seconds. Using clean and dry air, blow off excess silane and set restoration aside. To prepare the tooth for final crown seating, clean, rinse, and dry the tooth surface. Do not desiccate it, but rather leave the surface evenly glistening with moisture. Next, apply prime and bond adhesive. There is no need for a self-cure activator, just agitate for 20 seconds. Gently dry with clean air for 5 seconds. Before the final crown cementation, bleed a small amount of material from the dual-barreled syringe and attach the mixing tip. Then, bleed the tip. Apply a thin, uniform layer of cement to the entire intaglio surface. Seat the restoration and stabilize. Calibra Ceram Cement stays in its gelled state for approximately 45 seconds for easy cleanup. Excess cement can be tack cured for up to 5 seconds on the buccal and lingual surfaces. After removing all excess cement, the restoration can be light cured for 20 seconds. Because Calibra Ceram Cement is a dual cure cement, it can also be self-cured for 5 minutes. Calibra Ceram Cement cleanup is both efficient and effective. Whether it's tack cured or self-cured, it stays in a gel-like state for easy cleanup.